Hello, my name is Leanne Sherrod. I'm a speech-language pathologist and the President and Chief Clinical Officer here at Expressible. Thank you for joining me to learn how to support your child in making the S sound. This sound can be challenging to pronounce for lots of kids. The main reason is the specific tongue position needed to make a true S sound. We make an S sound by placing the tip of the tongue as well as the sides of the tongue at specific points in the mouth. Because this positioning is inside the mouth, it's not easily visualized. That can make it harder to teach compared to other sounds. For example, with the TH sound, you can see that the tongue rests between the teeth. A sound that's easily seen is easier for kids to learn. That's one main reason the S sound can be downright difficult sometimes. Another reason is the oral motor stability that's required for this kind of sound. The whole face, including our jaw, cheeks, and lips, needs to present stability in order for our tongue to do the work it needs to do for the S sound. Some kids are more prone to difficulty here, which may lead to more issues with the S. If a child is producing S incorrectly, it's likely that it is one of two errors. It may be a TH sound substitution, where sand sounds like fanned, or it may be a lateralized S. This is where too much air flows over the sides of the tongue. So in this case, S words sound slushy. So let's talk a little more about how to say the S sound and how to get the airflow sounding just right. There are two tongue positions that can be used to produce the S sound. The first one I'll share with you is the most common. It involves the tip of your tongue pointing up. The tip of the tongue should barely touch the bumpy part behind the top front teeth. The sides of the tongue should also be raised high enough to touch the insides of the top back molars. This ensures there's a tight enough seal so that no extra air slides over the sides of the tongue, which can create a sort of slushy sound. The air is directed only out the front of the mouth. Once the tongue is in the correct position, the person should begin to blow air out of the front of their mouth. It's almost as if they're whispering and prolonging a t sound. It should sound like s. Notice how the airflow is smooth. There's no slushiness or disruption to that airflow. That smoothness is one way to know that the S is sounding perfect. The majority of people will produce S this way, with their tongue tip pointing up. However, there are some people who can make a better S sound with their tongue tip pointed down. In this case, the tip of the tongue barely touches the back of the bottom front teeth. In order to make this tongue position correctly, try this. Say the ah sound. Did you notice that your tongue is touching the bottom of your front teeth? This is how your tongue needs to be positioned for the S. Move your tongue to this position, close your back teeth, then begin the airflow to say S. So take a minute and try saying the S sound to yourself. Can you tell if you use the tongue up or tongue down position? It's probably something you've never thought about before, but it can serve as helpful information as you help your child learn how to produce their own S sound. Have your child try the S sound using both techniques. If one position produces a better sound than the other, that's the one they should go with. So here's a recap of the key things we learned in this video. The S sound can be tough because of the way it's produced with the tongue. This makes it harder to visualize and teach compared to other sounds. There are two tongue positions used to make the S sound: tongue up and tongue down. One of these positions will come more naturally for your child and increase the likelihood that they pronounce S correctly. When it comes to S, there's definitely a lot to learn, but that doesn't mean your child can't learn it. With speech therapy support and lots of practice, it's absolutely attainable.